Mga kaigsunan, happy weekend! Higala niya na sa inyong paborito nga programa diri sa CCTN NTV. Kini ang bahandi o kini si Wong Jimeno. Pero sa dili pa tayo padayon sa atong programa, mga kaigsunan, ato sang abi-abiyon na atong kuyog diri nga maanyag sa atong programa, no less than Dr. Grace Balangkig. May adlaw, Dr. Grace?
Ay, Bong, may adlaw. Yes. Valentine's kay ka, ha?
Yes,
so,
because it's February.
Yeah. It's a month for the heart.
Yeah, month. Love month.
Love month.
Yes.
Oh, okay.
And for that matter, Dr. Grace, atong ihatod sa atong mga kaigsuonan, sa atong mga suking at televiewers, diri sa ato ang programa, ang maghisgot kita sa atong mga kasing-kasing. How to take care with our heart. Okay?
Affairs of the heart.
Yeah.
Pero lahi ni amo ang affairs of the heart. No, so ato is we have to be familiar kung unsa gid atong kasing-kasing kay importante ba kina sa atong kinabuhi, no?
Right.
Sa atong panglawas ang atong kasing-kasing. So, kita magutungod sa kabisi somehow, we neglect how to really take care of our body. But this time, we have our guests. Guests! Tulo man sila.
Yes.
Madami.
Yeah.
Mga kaigsuonan, tulo ka mga respetado nga mga heart specialist. Ang ato ang guest karon nga weekend. Kay nga no mga kaigsuonan, don't you know nga ang heart disease is the #1 killer now. Di ba, Doc?
Yes, that's right.
And then, this is one reason nga nung daghan ang kaso og disability.
That's right.
Right, di ba?
Hay lang ma-disable.
Mo lagi.
Kung goodbye, Philippines.
As we get older also, kanila lagi magkahamtog ta, Dr. Grace.
That's right.
Magkataas ang risgo sa mga heart disease. So, we really have to take care. No? Ang sa survey, Dr. Grace, at the age of around 45, ang lucky.
O, ang babae?
55.
Ay, okay.
Oy, pero mo lower na siya sa mga babae.
Yeah.
Especially og nagsigarilyo siya, kunya nag-take siya og kanibitang mga birth control.
Okay.
It will lower to 35 years old. Ang
Mao
ilang ang risgo
Oh,
nila.
I'm so glad I'm not into that. So, libre ko, ana. Anyway, actually, kanimang heart disease is actually a lifestyle disease.
Right.
So, pwede na ba yun ni siya na ito ma-avoid, maski na ano siya sa atong pamilya, no? Sa atong mga katigwangan or atong mga ginikanan, pwede na gid nato ni siya ma-modify or pwede na gid nato ni siya nga dili gid nga naata kita naa sa taana.
Correct.
Pwede na nato ni siya ma-avoid. That's what I mean. So lifestyle disease na gid ni siya.
Mao na mga kigsuonan, aduna kami gidala nga mga halangdon nga bisita diri sa atong programa nga bahandi to talk about this on how to take care with our heart, unya ang mga latest technology ug pananglitan na naman gid ganita.
Yes, oo.
Right?
Di naman gid na to ma-avoid. So unsa may angay na to mahibaw-an nga mahimo madiay nato nga ma-improve pag atong kinabuhi if we even if we have a problem with heart disease.
Right.
Yes.
Okay, Dr. Grace, the honor to introduce our guest.
Yes, of course. Ang akong i-introduce karon no, duha ni sila ka doctor ag usa kauban nila sa kaninga product. All right. To my left is ang specialist sa interventional cardiologist from the Philippine Heart Center. Let us welcome mga higala si Dr. Mario Villardo. Tagalog kayo, Doc, no?
Oo.
Maintindihan mo, nakakaintindi kayo ng Bisaya?
Konti.
Konti lang.
Kasi yung father ko came from Leyte. Pero
Konti
I
lang.
don't speak
Konti lang.
vernacular.
Sige. So,
Welcome to our program, Doctor.
Hello.
okay, and we have another doctor with us. Isa din siyang specialist ng interventional cardiologist from Chonghua Hospital. Welcome, Dr. Michael Jeremy Tavalo. Okay,
And the business unit head of vascular system, B. Braun Medical Supplies, B. Braun Philippines, Mr. Richard Wong. Chard, good morning.
Good morning. Thank you for having us here.
It's our pleasure also to have you here sa atong programa because ang daming manonood sa programa natin, Chard. Okay?
Oo. And then I hope that having them here, so meron tayong dalawang cardiologists.
Right.
So maganda ang discussion natin, isang Bisaya at isang Tagalog.
That's right. Anyway, first question din ko, Doc, basig mahot ng taguras. Doctor, what is coronary artery disease?
Okay. Coronary artery disease, CAD na tinatawag. When you say coronary artery kasi, coronary artery is the artery that supplies the heart. So disease, so ibig sabihin sa Tagalog, siya yung merong baradong ugat sa puso. Literally. This is as I've said in the introduction, lifestyle disease. So coronary artery disease. Pero dyan din pumapasok ang hereditary component, yung genetics. But basically, lifestyle, kasi nga, it's more on what we eat.
Okay.
On our activities in daily living, if we do not exercise, if we smoke, just so dyan papasok ang parang mga risk factors or things na it could lead to coronary artery disease.
Yeah. Dok, karamihan na notice ko, mas mataas ang ratio ng mga lalaki na may coronary heart disease. Probably, yun nga sinabi natin dahil sa lifestyle, no? Marami naninigarilyo, mas unhealthy yata kumain ng mga lalaki. Tsaka kadamihan kasi ng mga lalaki, malaki ang... mataba. Malaki ang tiyan. Yes.
Right.
So, I guess, it's also a risk factor pag marami kang fats sa tiyan. Di po ba?
Tama yan, ano? Generally, risk factor ang male kasi generally din by natural history, babae kasi they have estrogen, predominantly estrogen, which is protective sa babae. Yung protection na yon nababawasan pagka naka-undergo ng menopausal stage. So nababawasan na.
Kaya pala, pag babae, pag above 55, tsaka pa merong risk.
Equal na.
Become equal.
Ang risk na lalaki sa babae.
Kasi wala nang masyadong estrogen kasi nag-menopause na. Ako 80 pa ako mag-end.
Matagal pa pala manata.
Matagal pa. Sinabi ko na sa katawan ko, mamaya, tsaka na tayo 80 na. Huwag tayo magmadali.
Hindi ka pa kasali dito.
Hindi pa ako kasali dyan.
Wala ka pa sa bracket.
Right. Dr. Michael, what is ang incidence nito? And then, how do you do the diagnosis for the heart disease?
Okay, in the Philippines, CAD is the #1 leading cause of death. It's higher than
Cancer?
Cancer.
Infectious diseases.
Other infectious diseases combined. So, how do we
Siyang #1 diri sa
Number
ato
one
sa
yun.
Pilipinas.
In the Philippines and in the whole world.
Okay.
In the US? Number one.
Yeah, siguro no sa US mas grabe. They have more obese people
Yes,
there.
there are more obese people, so
Exactly.
it's really on the high. It's the leading cause of death. So how do we diagnose CAD? In our clinic, we can diagnose it through ECG.
Okay.
So through ECG, we can see if there is ischemia on the ECG, meaning to say there is less blood flow or lack of oxygen in the heart.
In the heart,
The
yes.
most common cause of lack of oxygen in the heart is coronary artery disease. So other non-invasive procedures that we can diagnose this is through 2D echo, and another is stress test. Once we have this, all these procedures that links or suggest that you really have a high risk for CAD, then we have the invasive procedure, which is the coronary angiogram, which
So,
is our
your basic diagnostic tools, yun ang 2D echo, ECG, tsaka the stress test.
And of course, the basic laboratories also, like your fasting blood sugar, if you are diabetic.
Diabetic. High risk kasi din ng
Cholesterol.
diabetic patients,
And
no?
high cholesterol.
Triglycerides,
Triglycerides.
So yung mga laboratory,
Increase the risk.
din, findings.
Physically,
yun.
doctor, we can also see that posible ni siya nga na ay CAD.
Importante din kasi sa history.
Weight, no?
Symptoms
Yes,
ng
of course,
pasyente.
obesity.
Symptoms, oo.
Doon talaga tayo din
So that's where you base it actually siguro, di ba, Doc, sa symptoms. If the patient are complaining of these symptoms,
Chest
maybe
pains, ganyan.
chest pain, siguro.
Madaling
Is
pagod.
apnea part of it?
Dyspnea.
Is one of them, apnea?
Shortness.
Siguro more of easy fatigue. It's
Easy
impossibility, madali ka mapagod.
Mapagod.
Dati
Uh-huh.
nakakalakad ka ng 1 kilometer and lately parang napapansin mo, few steps lang going to the comfort room, parang meron ng chest pains or symptomatic ka na, madali na mapagod.
So yung may mga diabetes na pasyente, may mga diabetic patient pala. Ano ba nangyari sa buhay ko? Hindi na ako marunong magsalita. Na-mix up mga akong brain. Yung ba mga diabetic patients are really high risk. So if they have diabetes and then it's been there like say for 5 years probably, then dapat i-test po talaga sila for coronary artery disease.
Tama ka ulit dyan. Kasi it has been established that once you have or you've been diagnosed with diabetes, that's already equivalent to having a coronary artery disease.
Right.
Bakit po
Kasi
yun, Doc?
naglalapot ang diabetic ng lapot man og dugo. So ang pag-flow niya ngadto,
the
less
flowing
kaayo
of the blood going to
oo.
the heart pala, yung pagpapump?
Yes.
Right.
Diabetes also accelerates atherosclerosis. Meaning to say,
Yes.
if you are
The
the same,
hardening
have
of
the
the-
same cholesterol level and you are a diabetic patient, if my artery becomes blocked in 10 years, your artery becomes blocked in 2 to 3 years already.
Really?
Because it
Oh.
accelerates atherosclerosis. Mas madaling
Mag-progress.
mag-progress
Progress.
yung plaque mo, mag-build up.
Tsaka ang problema sa diabetes, ang naapektuhan sa kanya are blood vessels.
blood vessels yun.
So, blood vessels sa utak,
Lahat.
sa kidney, sa
Sa brain.
brain, sa
Brain.
puso, ganyan. So lahat actually. So yun ang problem sa diabetes.
Right. Unya mga kaigsunan, don't be wrong, no? Ang ato makita man gud, especially sa movies gang, ato makita nga gi-atake gani kanang makuyapan niya, matumba sa floor. But there are other symptoms nga dili ta kahibaw ba ya? Just like katong giingon nila ni doctor, di ba? Lightheadedness,
Oo.
unya kining ato abitong how they call this, nainausea usahay, vomiting. Unya usahay ka ng murag slight pain lang sa atong jaw.
Because
Slight na mga inaana nga usually dili na ma-detect nato nga padung na din nga ngadto sa CAD or stroke.
I think what you're mentioning are anginal equivalents.
anginal symptoms.
Pag sinabing angina, parang simptomas yun na sumasakit ang
Dibdib,
dibdib. Kunyari yung tao naglakad, supposing yung taong yun is merong baradong ugat sa puso, naglakad siya, napagod, sumakit ang dibdib. Yun yung tinatawag na angina. Pero meron mga equivalent na hindi man equivalent, ibig sabihin, binanggit mo ng jaw pains, pag napagod, instead of having the symptoms of chest pain, nagkaroon ng jaw pain,
Right.
nagkaroon ng numbness ng left extremities, nagkaroon ng epigastric pain. Para may equivalent symptoms yan. Ibig sabihin din, pwede siyang, yun ang anginal equivalent.
Let's
Or-
cite a case,
Okay.
Doc, because this one I just experienced this. Uri ko ka ba musulti? Naglibog ko kung magbinisaya ako magtinagalog. Hindi kasi
Mas nahihirapan na siya.
Nahirapan ako. Ang utak ko na ako confused. Kasi Doc, ang nangyari, I have this one person that I've known, hindi man siya couch potato. So, he's a coach. Coach
Okay.
siya ng, actually this happened in Canada when I went there recently. Coach siya ng hockey. And he drives a truck. And
Okay.
then, coach pa rin siya ng baseball and other sports. So, he's into sports, but he's big. He's big talaga.
Candidate kay Tugang.
So, what happened was, no, he died.
tama ka.
He died. Because he was driving and he suddenly developed a heart attack and he died because may collision. So, he died from heart attack. So, it doesn't mean ba, Doc, na if you are an active person and yet you still have a problem of the weight,
Right.
you're still predisposed to this kind of disease.
Kasi isa rin sa mga predictors yan na yung waist circumference.
Right. That's very basic gang. The waist
Obesity
then the
itself.
BMI.
Body mass index.
Yeah, that's very important.
Okay. So, Gang, we need to pause for a break
Oh,
at this
okay.
time. And then we will come back to that mga BMI, mga sa to waist circumference. We will come back for that. Ato ipa-explain na aron kasabot yun ta kung unsa gipot ipasabot ana aron makahibaw na ta unsa ba di ay ni siyang atong gipanghisgutan karon. So we have to pause for a break mga higala. Diha lang mo because we'll be back.
Ang nangaging panahon, dili na nato mabalik. Apan mahimong buhion sa atong kasing-kasing, pinaagi sa mga huni ug awit, kamupukaw sa nahikatulog nga pagbati.
Kunang suwang sa kapalaran, mamalungat to sa lunganan, nasamad naking dukan sa pagpasalig mo. Why Sayang ako sakiton. Lahi ang kabulakan nga katiding panon. Naku nga isinggit ko karon nga masayran ning kalibutan. Ikaw ang langit ko, hinaut nga masayod ka nining tanan. Pagkabangis gayod ay sa akong gidangatan. Arad kun saun man ngang damgutan mamalik pa.
Kuyugi kami sa among paghanduraw ug paglapas ug balik sa mga awit Cebuanon nga nahimong dakong tipik sa atong kinabuhi. Handurawan, matag Sabado, alas 9 sa gabi, dinhi lang sa InTV, CCTN Channel 47.
Welcome back to Bahandi. Of course, kuyo gihapon nato diri ang atong mga bantugan nga mga cardiologist. Unya naghisgot kami before ta nag-break man kaigsuuna, naghisgot mi diri ni Dr. Grace ug atong mga guest regarding this waist circumference o katong BMI. Diba, Dr. Grace?
BMI is body mass index.
Oo. Usa sa di siya sa mga physical kanabitong makita sa mga doktor ba nga posible nga na ay mga coronary disease, no?
So predisposed di ay kaani nga disease. So kung i-diagnose ka or maadto ka sa doctor, magpakonsulta ka, so usa day ni nga makitaan mga clinical kuan ba manifestation nga makita rin sa doctor nga ma-diagnose ka nga basin kani na ani siya problema. So kaning waist circumference, so that means dako kag hawak. Kung dako kag tiyan.
Yes. Unya, according sa survey sa Dr. Grace, ang laki dapat above 40 gani centimeters ang iyang waistline, dako na posibilidad. Nya ang sa babae murag pwede ra siya diri sa mga 34.
Okay, layo pa ko.
Grabe. Layo ra ka.
28 pa ko, 27.
That's why, no?
Dili na edad ha, hawak. Okay, so unsa siya Dr. Mike nganong naagid ni siya apid ni siya sa atong pag-diagnose kani mga manifestations or mga physical features sa pasyente nga magsuspekta na ana siya CAD.
Yes, we get the BMI of the patient as they go to our clinic, no? Because we assess if they are just overweight or they are already obese. You know? So the higher your BMI, of course, you're already obese. You know? So if you're obese, you're at high risk of, as Dr. Villardes have said, for coronary artery disease, because the bigger your waist, the more fats, are stored in your body. So that's
more
fat.
love handles.
If you were not able to exercise, meaning you did not consume that fats, which is supposed to be for your exercise as a source of fuel of your body, then it will be stored in your body as well as in your arteries. So it will cause obstruction of your. So you have a high risk for CAD if you have a high BMI.
So, ato i-explain, Dok, kung sinang BMI. So, as we said, it's body mass index. So, inyong i-compute, Dok, no, ang height
the weight
over the weight.
Yes.
So, kung sa kakabugaton sa imong height, insakto kay naagi na sa sakto nga proportion sa imong lawas dapat. So, we have a machine, Dok, no, because I sent my mom to a doctor. So, gikuan siya body mass index katong mura siya weighing scale na siya gipagunitan nga it's connected, no? Connected siya sa weighing scale ang katong ipagunitan ng something. So, dito gikuha ay ang body mass index.
Kaya kita go Dr. Grace naman tayo. For example, kung sa kalakatason dapat inani ideal weight
Ideal body
inani.
weight. Yes.
Inani ka kataas 5'2" dapat inani lang. 5'4" ko dapat inani lang.
Pero ang kuana na Doc, di ba, within the range of 18 to 25, no?
Yes,
Yeah.
18 to 24.
18 to 25 ang body mass index
Yes,
nimo
that is
dapat.
dapat.
So mulagpas ka din ha.
candidate ka na
Candidate
for
Risk
na
lang.
ka.
obese.
At risk.
At risk.
At risk
Yeah.
ka na
Okay.
siya.
Abi na akong candidate dito sa ano, Doc? Sa CAD.
Candidate sa angioplasty.
Hindi pa rin nakakatakot na eh.
Yeah, so at risk na ka. So that means, as always, kung ato gini siyang badbaron, that means kung bugat ragyod ka, dako ragyod ka, then at risk ka for CAD.
Oo.
So kung medyo bata-bata pa ka, napadung pa kag 40, magbantay na, no? Dapat you have to lose weight. Yes.
You have to exercise.
Okay,
Be active.
Yeah, because
Be
I have a
active.
friend, ako sige explain, dako magud siya diri.
Siya yung
So
namatay.
nag-lose na siya weight sa body. He has
Okay.
a good weight. But here, it still
Very.
remained there's the fats really. So I said that I guess you have to go for more exercise. You don't need to lose weight actually, your body weight, but you just have to lose the fats in your stomach.
Right,
Yeah.
right.
Belly.
Yeah.
Pero
So-
that's just one component. Pero at least madami pa kasing predisposing factors eh.
Like,
Edad.
Edad.
Oo.
That's
Yung
right.
Diabetic
na-mention
siya.
natin, yung
High
gender
blood.
din.
High
Oo.
blood.
Those
High
who
blood.
has diabetes and high blood. Those who smoke.
Smoking.
Smoking.
Lalo na. Oo.
Tapos yung mahilig kumain ng taba at saka karne.
Mga lechon.
Oh.
yun. Ang lechon sa
Kumakain ako nun eh.
Cebu.
Oh, masarap yun eh.
Yung
Lagi
eating,
ako
ang
nagpapabili
eating
nun.
habits din, Doctor, no?
Oo.
Yeah, because it's lifestyle good. Lifestyle good siya. So, kung naana siya, kasi naghisgot ta, we mentioned earlier that it could be hereditary. Yeah, but during the introduction, I said if not necessarily, if it's in your family, not necessarily you will have likely to have that kind of disease as
Hindi
well.
naman 100%.
Hindi naman siya 100%. Although, medyo at
Andun
risk
lang,
na ka,
andun.
pero you just have to be careful. So, kinala ma-exercise, mukaon og nutritional food, no?
Right.
High nutrition and
Yearly
less
checkup.
fats. And yes,
Yearly
of course,
checkup.
yearly checkup.
Yes,
Hadlok, you know what? Most of them, hadlok magpa-check up.
Correct.
Ayaw.
Mo may
Oo.
sultigod sa itong mga katiguangan diya usahay nga, di na lang sila magpa-check up gang, kay nga no,
May bawaan nila.
Mahatos lang mahibawan nilang sakit.
Malaman
In
nila
which,
meron silang
Ang ato
sakit.
ring campaign sa Bahandi, mga kigsoon, is to really see your doctor regularly, bisag once a year or twice a year. Especially yung kinang nagkahamtong na ta, we need to do the regular check-up yun.
That's
no?
right, especially nga kanabitang daghang tagbisyo, no? So, ang atong lifestyle mo rag dili maayo, at least ka nang be responsible sad nga. You have to really submit
Madami.
yourself for check.
Yeah.
Yeah.
And as we grow older, manggod, murag payback time na siya nga. We need to take take care of ourselves, di ba?
Madaming
Okay.
pasyente kasi din na asymptomatic, walang nararamdaman, and yet pag nakita mo sa clinic, yung BP mo 200, 180, madaming ganyang kaso. Tapos mga routine sugar monitoring, matataas na pa yung blood sugar, and yet wala pa rin nararamdaman. So, hindi porket wala tayong nararamdaman, wala tayong sakit.
Gagawin.
Oo.
Because they do not go for annual checkup.
Importante rin kasi
Yeah.
yung na-evaluate kayo, pero annual na physical examination, ganyan. Preventive measures.
So, karing, we
So
call it,
dapat we call that ko preventive maintenance.
Para sa sakyan eh, no?
Oh, we do
Para sa
preventive,
sakyan.
preventive maintenance. We have to do
Okay.
that. No?
yeah, so, gi-explain na to, this is a coronary artery disease. So,
Right.
ibig sabihin, in layman's term, doc, ang imong artery, ni narrow, ni gamay, ni bara.
Labara.
Oo, tungod sa tambok, cholesterol or arteriosclerosis ni gahi ang imong artery.
Yes.
Yeah.
Kay daghan na kay
Or
cholesterol
deposit.
ni deposit
Correct.
dito. So we call it also plaque, no?
Plaque.
Calcification.
Calcification.
Yeah.
Kasama din yung kasama
Yung coronary gang because going through the heart.
To the heart man, no?
Coronary artery.
Oo.
Yes.
So it's practically the blood coming
From the heart?
Going to the
Going,
heart pa.
going.
Going, padung pa sa
Padung pa
heart.
yun, oo.
It's the artery that supplies the heart.
Oo, and the venous mo'y pagawas.
Pabalik.
Oo,
Pabalik,
tama.
palabas,
Tama.
di ba? So,
Kaba pa kasi mo anatomy. ha?
yes. Zoology 1.
Hoy, baki man to. Zoology. Di ba yung palaka yun? Anatomy?
Anatomy. So,
Anatomy
yun.
and physiology.
yeah. Anyway, and that's very important, especially if the hardening of the arteries,
Arteries.
is already there.
Yeah,
No?
yeah, exactly.
So that's the
That's what
thing
happened to...
that's very important.
Yeah, that's what happened to my father. My father has a very good physique. Kasi bodybuilder siya. But he had a very high protein diet because of,
Because of
he's on a bodybuilding.
Mm-hmm.
So high protein diet siya. When he reaches the age of 55, I guess, when he was in 50s, okay, about late 50s, he developed na arteriosclerosis. So there's a hardening of his arteries na. Tapos marami ng complications. So we cannot do anything about it anymore. So even if nasa maintenance siya, but it was kind of late already because he was very confident. Kasi ano siya, sportsman siya eh. Ang ganda ng physique niya talaga, hindi siya malaki tiyan.
High blood siya.
Pero nag-high blood siya sa 50s na siya. Late na.
That's very, prone siya gang for CAD.
CAD. So that's what happened to him. Yeah.
Hindi rin kasi guarantee na porket
builder siya, physically siya.
Or na 100% wala ka na magiging sakit.
Tapos maybe you weren't able to check the food intake.
Oo, kasi high protein man
That's
siya. So he's on meat.
Meat talaga.
Meat siya. So probably that's where he got it. More on beef siya, beef.
Okay. That's why.
Yeah, so not really on lean meat.
Right. Doc, what is unsa man ning coronary angiogram?
Okay. Coronary angiogram is a diagnostic procedure to detect if you have coronary artery disease.
Okay.
So it is done through the groin or we access through the radial artery. So we pass
diri sa kamot diri no, nang dako diri nga artery.
We just put a local anesthesia and you are just awake during the procedure. You're just mildly sedated. It's just about less than 30-minute procedure. So we pass the tube or the catheter going through from the groin or the radial artery going through your heart. And basically most of the patients become afraid because they thought that it would be painful. But once the catheter is inside the artery, it's already not painful. So you won't actually feel the catheter going through your heart. So once we cannulated the artery already, then we inject a dye which will be shown on the X-ray where you can see the occlusion if there's already narrowing
of the artery.
Ilahisa
na siya ang angioplasty. Sa angiogram.
Yes, the angiogram is just the diagnostic procedure.
Para makita sa X-ray kung nay bara. Asa dapit nay bara. At the angioplasty
is the intervention already where we open up that blockage. So there are a lot of techniques, procedure with angioplasty. So let's go through the history of angioplasty. So it started in 1977-74 where the first human angioplasty was done by Andreas Grundzig. So he put a balloon, a collapsible balloon inside the artery, then he blow up the balloon to open up that artery. So that's the first angioplasty done. 20 years later, since they found out that after just doing angioplasty with just the balloon, the artery recoils or returns back. There's already
balik siya
because there's no support.
Because there's a pressure man on the balloon, so muhiyos gid ang balloon madugay.
No, the balloon is removed after you just open up.
So gi-open na siya nimo. So you don't do anything. Wa ba kay gi-scrape, wa ba kay gitangtang.
So gi-open lang already if you get the actually there also we can also remove the plaque through catheter.
Uy ka naman kanila daw ba? Murag liposuction daw ba? So yupon.
Murag yan na, liposuction?
Yeah. No, you do it rotablation, rotablate.
Tuyok ko siya kay consuction nun. Wala mabusin.
But it's not very common to do rotablation because there are also
there are some
increased
indications
risk
for that.
Does it differ, Doc, ang angioplasty sa bypass?
In terms of what? Madaming difference. Like, kunyari, isang ugat lang naman ang barado where we can do angioplasty. Pwede yun. Indicated din naman ho yun. Shorter ang hospital stay mo compared sa bypass. Less ang prone to infection unlike bypass kasi open wound, ganyan. Gastos,
mas mahal yung bypass.
Depende rin actually. Depende on the number of stents that
nagagamitin.
Kasi the device itself is kind of expensive.
So these are the procedures, pag may barado na, these are the procedures you
options.
options na
Treatment options.
pwedeng angioplasty kung hindi pa marami.
Okay.
Yes.
Or kung
Bypass.
talagang may
Marami
ano na,
na.
mahirap na yung case, then that's when you
Yes.
do the bypass.
Yes.
Okay. So we always mention bypass. Can you explain to us, Doc, ano ba yung bypass?
Bypass, yung bypass, ang idea lang nun, parang kang binabypass mo yung baradong ugat eh. Like if
Common to traffic.
para kang gumagawa ng flyover lang.
So saan ka magkukuha ng
You
ugat?
get a vein sa lower extremity.
Okay.
Ikakat mo yon.
Kukunin,
Yes, you
kukuha
harvest
ka
that.
doon. kukunin mo
I-harvest
Yeah.
at
yun.
ilipat
I-implant mo
doon.
Yes.
From the aorta, yung pinakamalaking ugat, tapos lalagpasan mo yung barado.
So i-connect mo siya doon sa main
main.
artery niya doon.
Mhm.
Tapos yung barado,
Yung-
lalagpasan mo, doon na
yung-
siya dadaan sa
in
bagong
distal
nilagay.
end, it will bypass the black,
black
artery.
artery.
So,
So,
kunyari
you make a
nandito
neuro-
yung
Black. Diyan ka.
lalagpasan mo lang siya, iba-bypass mo lang siya.
So that's why it's
So
called bypass.
iba na siya,
Oo.
iba na siyang daanan niya. Hindi na siya dadaan doon sa block.
Hindi na doon sa
Yeah.
native na artery na
Oo,
tinatawag, or
meron kang,
original.
may kinabit ka na ron. Yung
Yes.
hinarvest mo, doon mo siya nililipat, doon na siya dadaan.
Yes.
So isusuture yun, Doc.
Yes.
Yes.
So, ang purpose nun-
Microscopically, ano tawag doon?
Oo,
Yeah.
meron silang
Microscope.
lens na ginagamit during surgery. Parang magnified. yung
Magnified
image.
siya kasi ang
Kasi
liit
maliliit
no,
yung
ang
structure ng vessels.
oh,
eh.
very fragile yun, very manipis.
The
Yeah.
purpose of which is to improve yung blood flow. Kasi pag yung narrow ng vessel mo, yung blood flow mo, limited.
Limited, oo.
Oo.
Limited
Kaya ka
ang-
nagkakaroon ng chest pains, kaya ka nagkakaroon ng
Kasi
angina
konti yung pumapasok na
Oxygen.
blood, there's less oxygen in the
Yes,
heart.
yes, oo.
So that's why nagkakanaw siya, nag-dizziness
Vomiting.
because there's less oxygen in
Right,
the
right.
brain.
Irritability, chest pains.
So, doctor, ang over angioplasty and bypass, mas maganda ang angioplasty?
Depende sa
Depende
case.
sa case. Case to
Oo.
case
Sa
basis
case,
pa rin
yes.
siya.
Di mo nga pwede mo to, Doc, angioplasty lang ko. Kanina ako choice. Mura ka niya
Actually,
sa
may mga
fast food.
Of course,
May mga
ano
pasyente
na,
rin kasi din eh, na
Yes,
na
choice
gusto nila,
Yes,
choice nila
choice
talaga.
nila.
But
Kasi
still,
yung iba
the
We
the
still
last
recommend the
decision
best,
is still on the doctor
Yes.
kasi
Yes.
you're the ones who know
Yes.
really
Oo.
exactly what the condition of the patient.
Correct.
Yeah.
Especially,
Yeah.